So the RPS is making these changes now in terms of becoming a Royal College and changing the organisation to be a registered charity, because the speed of change within the NHS, within healthcare, is rapid. It's changing incredibly fast. We are seeing pharmacists and pharmacy teams being embraced as key members of the healthcare team. So many changes in terms of drug development, in terms of the services that are offered. Pharmacists or pharmacy students now will be registering as independent prescribers. So we need an organisation that can embrace all of these changes, that can position the voice of pharmacy and be respected. So it feels now is the time to really embrace those changes and the speed of the changes and really make some significant changes to the way the RPS operates and to how we essentially face into the world of healthcare, to make sure that we can embrace the changes and embrace the opportunities that we now have for pharmacy and pharmacists specifically. Now seems to be the time to make these changes. The significance of becoming a Royal College for our members in England, this comes to the point in time where we are, where we have the NHS at the point of making a significant, a generational change in terms of how the NHS is there to treat patients and to look after patients and keep them in healthcare, and really understanding that the way that the role of the pharmacy team, the role of pharmacists now has really evolved, and the NHS is really embracing that. So being a Royal College will enable us to be able to ensure that when healthcare policy is being made, we are heard, we are seen and we are heard at a par and a level to the other Royal Colleges, and that we're not left behind in the changes that are coming. Now is the time for us to really make these changes. So practice of pharmacy is all encompassing. We know it stems from drug research all the way through to counselling your patient as you're handing them the medicine. And within that journey, we have so many different elements, so many different sectors. And what's really important, I think, for us going into this Royal College is unifying all of those different strands of pharmacy, bringing it together under one roof almost, having that collaborative, unifying one voice that is respected, that people come to us as the respected home of pharmacy. And they want a question, they want something answered, they want the view. They'll be able to come to the Royal College and have that confidence that we are speaking across the whole of pharmacy. Because that's our vision and our mission, really, isn't it? So bringing it all together under one roof, I think, is very, very important. The things that we're doing now in pharmacy, when I first qualified 30 years ago, I thought should have been happening then. So for me, it's incredibly exciting that they're happening now. And I think that it's taken us this long to get here. I think the developments that we're going to see in the next 10 to 15 years are going to eclipse the speed of this. And if we don't make these changes now, we will be doing a disservice for the new pharmacists, the new generation of pharmacists coming through. There is so much that is happening. We need to be in that position to be able to embrace those changes. We don't know how everything's going to turn out, but we need a structure and a functioning organisation that is ready to embrace that for the new generation of pharmacists coming through.